title of our presentation is Solving the New Normal in School Healthcare. We'll try our best to define what this new normal is, and then also share a little bit of what we've been doing in schools all over the U.S., right? Defining what is this new normal, right? I don't want to, I know this is all over, like the place, and we're probably tired of this right now, but we do need to bring COVID as part of this new normal in healthcare. We know that a lot of things have changed because of the pandemic, and the education was impacted, right? Also from, like an attendance perspective, and also access to healthcare, right? Which is the focus here. But again, bringing to this equation, the COVID is an important piece. Not as COVID, but, hopefully not, but any future pandemic or healthcare related issue that we might encounter, right? So we need to be aware of it. There is a shortage of nurses, well, clinicians and medical professionals. This is all over the news. Folks in this call, you guys might know better than us here, but this is, again, that's not news. We do have in schools, they are affected by the shortage of school nurses. One thing that we do because of our approach and the way we believe in the like telemedicine and the platform, and I'm going to get there later. If we think about rural places in the U.S., which is the example for this presentation today, it's even like worse. I have a graph after this slide to share with you, but again, part of the equation is the like healthcare and also the shortage of medical professionals. I hope this changes, right? As a society, we should have more doctors and nurses, but again, I think this is a longer discussion. This, again, is part of the challenge that we see right now. And also, right, and not, like less important, it is that we still have kids going to school. They still need to have, like access to healthcare through their local school nurses, like on their district level. So kids will still be sick. There's a mental health component because of, all of the anxiety from the past few years. We know that this, like took a, hit pretty hard on kids. So the mental health aspect of it, and also the fact that for those of you who have kids, like people are busy right now, right? We do have parents that are busy, and if we can facilitate things so we keep parents, like at work, kids at school, this will be kind of the perfect outcome out of a project as we see, right? So kind of defining what this new normal, right? So I'm bringing out this graph that is from one of our projects in rural Utah. So in rural Utah, we have one nurse every 5 schools, right? And this nurse, on average, sees 3,500 students. The average distance between schools is 50 miles, right? So again, the human resource on this aspect, we cannot solve like quickly. Thank God there is technology to help us in this approach. So again, I can talk a little bit more about what we do there. But again, this is, again, the reality. I'm just bringing an actual stats from the like Utah is, like an important state in the U.S. with a lot of rural areas. So this boils down to access to care, right? So if you're, like if you have a kid, or if like children at school, they still need access to care, right? Even with all of these challenges that we mentioned before, right? And we want to keep kids at school, right? So the fact that with technology, we can make them, like stay at school, only go home, and, like disrupt the parents' day if it's really necessary, also is a way of tackling. But that's, again, I have a video at the end of this presentation that I can share that you guys will understand from the district nurse point of view, right? So again, if we had to boil down the challenges in this new normal, these two will be it. So new normal in school healthcare requires a new model of care, right? So in this new model, again, we've been using and deploying, being part of projects all over the world that, uses this new model of care, and you understand a little bit more. But this new model now, talking about school healthcare, is to use existing resources, right? So if you have a school in a rural district, let's say in Utah, right? It's hard for you to build a new clinic, bring doctors to the region, right? So again, using existing resources that you have, and in terms of rooms, like health aides or staff members, connecting you with the local providers. This is again part of how we need to address the problem, right? And some of the photos here, they are from actual deployments that we have. So using the existing resources that you have available, this is key. From and of course, there's the quick turnout, and also the economic impact that we can bring quickly. So this is not an expensive solution if we can use what is already available, right? Also, and this is again what we've been doing, is bringing a platform, right? So health screening, but telemedicine, but teleeducation, right? This is what our e-clinics are providing all over the US with our e-clinics. So I will talk a little bit more about them in the next few slides. But again, if you want to see how, like physically our e-clinics look, this is pretty much it, right? So we do have this portable, affordable, easy to operate kits in hundreds of schools in the US, providing access to, like diagnostic tools, video calls if needed, the ability to collect healthcare information from these patients and sharing this with healthcare organizations, with the government, you name it, right? So I'm gonna go through each one of these features in the next slides, but just wanted to give you a view of what, when we talk about e-clinics, of course we have the software component and how we connect all of these dots, but this is how our e-clinics look like, right? So the goal, right, to keep kids in school, improve their on-site care, and also we have the ability to promote staff wellness by developing wellness programs, right? So health screening. So imagine that you can have on these stations at each one of these schools the ability to collect information from social determinants, healthcare information, anything that, like a school district, the health department, or a healthcare organization need to collect in a simple way, right? So collecting this information using one of the options that we have in our tablets, to have these forms that can be fully customizable, so that is controlled by the clinical team from our customers. We're just the ones facilitating and being the guys with knowledge in these types of projects. And this is, it's been key not only in the US, but, having visibility about, overall trends or the healthcare, like scenario. This is huge, right, for everyone involved in school healthcare. We bring the ability to connect easily with smart devices. So if a kid is sick, not feeling well in the school, complaining about headache, we give the health aide in the school or a trained staff member the ability to use, let's say, an otoscope and get some images, get those images live to a nurse who might not be in the school in that moment, or to even escalate and talk to a physician or a specialist if we need. But we do have the ability to bring the devices that are FDA approved and apps that might also help in the health assessment. We do bring the telehealth portion, like the video conferencing feature, right? So again, you can use if a kid is not feeling well, you need to connect to a doctor, to a nurse who's not there. If you need to invite a parent to join a call, we have the video call feature that is super easy to use, and the ability to invite a parent, language services that we have also built in. This is huge on the school setting. And as I mentioned, kind of the staff wellness, we also have the ability to promote and use these e-clinics with, so the staff members can do quick checkups on their health, maybe for a month, and then, like the school district or the school healthcare organizations can promote these wellness programs within the school staff. All of this, again, is part of what we call our platform, is part of the e-clinics. Ram, anything to add? Since we're kind of going through features, I know you're here, just...
No, I think you did a great job giving a good summary. Schools are facing a challenge. Dealing with healthcare is something that they are forced to do. To some extent, they care about the kids, but their mission is education. As we learned in COVID, they are forced to deal with healthcare. So we need to try to find a way of helping them do it, because it's becoming part of the routine within the school. And what we outlined here is the new model in which you do some health screening in schools, so you can know if your kids can be attending. What are the issues? Everything from hearing, vision, generic healthcare. And you can bring in the school nurse or a district doctor, bring them in, because what you want to do is not keep the kids in school, you want to keep the right kids at the right time. If a kid is sick, you don't want to keep in school. But most of the times, kids are healthy with some minor issues and can stay in the school. So being able to bring the right medical or healthcare professional in is the new model, not full-time necessarily in the school, especially in rural schools that are small. You need to be able to leverage remote resources. So that's the new normal. How we keep the right kids at the right time, how do we help the school do the screening when it's needed, and as the pandemic proved, people are more aware of their healthcare. So being able to let the school principal check up their blood pressure, which, by the way, is a use case that we held in some of the places in Utah. These are the things that help the school provide more education and with this new model of healthcare within the schools. So back to you.
Okay, yeah, and I will just illustrate what you're saying in terms of bringing the health screening information, and how now school districts, health departments, they can also have visibility in a business intelligence like a platform that will bring all of that information together, just to give some color to what you were saying. On the devices side, just quickly going through, as Ron was saying, like this is on the school setting, the devices are pretty much this. We're an open platform in terms of which devices we select to be part of the e-clinic. So, but yeah, just highlighting the dental camera that we have, super useful, high quality. So for schools, the champion, the otoscope for kids. For those of you who have kids, like the otoscope is used to quickly identify any ear infection, and also like other devices, as you see, kind of glucometer, thermometer, the ability to connect with hearing and vision apps to also help on the health screening within school setting, right? So we can always share a little bit more with you for those who are interested. So as I said, right now we are at kind of hundreds of schools in the US, right? They are benefiting. Some of the school projects that we have are directly with, like state affiliated groups. Some of them are through healthcare organizations providing care. The healthcare organizations have contracts with school districts directly. And these, again, as you see, our e-clinics all over the US right now benefiting these kids, of course, which is the main goal. So I will kind of show you a quick video. This is a highlight. We do have the full video to share with those who are interested, but with one of the school, the lead nurse in a school district in Utah, talking about how she uses the platform, and some of the challenges for those of you working in the school health scenario will be similar. So let me.
I am super excited to talk to you guys about what we have set up in Wasatch. And I think that we're all on the same page that kids really do benefit from being in school. we started offering point of care testing and telehealth with connection to a care provider. Telehealth aspect of it is such a fantastic aspect of our school-based clinics. So our telehealth equipment that we use is similar to almost everybody in the state, which is the Gale units from 19 labs. And this would be what I'm referring to as our infrastructure. On the 10 visits in this month and a half period that we looked at, 60% of those visits, so 6 of those visits did not miss any days of school at all because of telehealth. 100% of our visits received a prescription. And on average, our telehealth visit length from when we see a provider to when the child is returning to class is 20 minutes. 95% of our students who receive a standing order return to class who would have otherwise been sent. So it's keeping 95% more of our children in school who were being sent home before. That's huge. We have 100% parent satisfaction with anybody who has used either standing orders, point of care testing, or telehealth, and 100% teacher and administration support at this point too, which is pretty amazing, quite frankly, for anything health related in a school system. So a couple of critical aspects as you're considering how you might implement this into your own school. We also would need consent. Another critical aspect is making sure that the people that are driving on your infrastructure know how to use it and when to use it. And then also connection to a healthcare provider. Without a connection to a healthcare provider, our clinic would do far less good than it already is.
So as I said, for those of you interested in a school-based telehealth project, we do have more resources. We do have the same model and approach, not only for school-based telehealth, a lot of rural projects that we are involved in the US and all over the world. So for those of you interested to, connecting with us to learn a little bit more about the approach, about the technology, we would like to, keep this conversation going. And I think now it's time for questions. Let me see. Yeah, I hit the mark that I was expecting. So I'm happy to also to not delay more of the program here. So I can stop sharing. I can share these slides with everyone. Of course the organizers can help me with that. But anyway, any questions, any comments? Rom, anything to add? Like to wrap up this talk here?
The one thing I will add is that in some schools, the funding for the school is dependent on attendance and keeping attendance and kids staying within the school. Complicated system, not all the schools, but in a lot of them that's the case. What we have seen that having the system in a school really reduces absenteeism. When a kid knows that he can go in and when he says he's sick, he's not automatically excused and there's no automatic call to the mom, come please pick your kid up, but there is a nurse that he will have to talk to. Suddenly a lot of my head hurts or my stomach hurt goes away. And the bottom line is that the school funding and the school attendance and the overall education is better. So financially, it makes sense for the schools. It helps schools provide better education. And it does it realizing the constraints, the physical constraints and the staffing constraints of the school without overburdening them.
Good.
Any questions?
Yeah, I don't see any questions.
Do we have time for questions? Or?
Yeah.
Yeah, we have a few minutes, so now is a great time. If you have questions, please enter them. Whether you're in Zoom, you're welcome to enter them in the chat or through Whova. There's a side panel off to the side where questions can be asked. Very great presentation. For me, I know CTRC, we've kind of gotten more involved into school health resources specifically for telehealth in school-based settings. More recently, I think we're getting more inquiries and seeing more cases of schools using telehealth services. So it's great to see that you have so many resources available for schools and partners looking to work with schools to kind of get started. a lot of great benefits there.
Yeah, we consider, I mean, the telehealth, right, or the video connection is one aspect, right?
Mhm.
If we can bring a platform that has this capability, but also can be used for education, for, you know, the screening information that, again, you don't need a nurse to do that. Maybe a staff member will be able to run a health screening. That information will be available for, you know, like the groups interested and allowed to see that, you know, connection to devices. We had an interesting story in one of the kids in the, I think that was in Utah.
The one thing I would add is there are often funding from the federal government for those programs. So if you are working with a specific school district or a state or a county, it's worthwhile checking because often those funds are going to waste. So go check with the different school districts or the state. There is funding to get those programs going.
Great point. Yeah, we'd love to hear if you have some interesting case studies or student experiences.
Yeah, no, what I was telling was that, yeah, so I mean, sometimes what saves a kid's life was, you know, like the most inexpensive device that we have in our kids. So we had this story of this kid that was not feeling well and went to, you know, like to see the staff member. They just plugged the pulse oximeter on his finger, and it was something like, I don't know, 80 something. It was kind of super, you know, like you know, like that it was an emergency in that situation, right? So again, the aspect of a platform, right, that allows you to use a simple device, but also in some cases you're going to use the full extent of the platform, connecting with the doctor, showing your, you know, like inside the ear of a student and all of that to make some, you know, informed decisions. Again, that's the model we believe, and how important it is to have an affordable solution, because a $1 million solution might not be a you know, like especially for, you know, like in these times. So yeah, our e-clinic is not $1 million, so that's the good news.
Yeah. Great. I am seeing a question submitted in the chat, so I'll read it out loud. In addition to physical health, can the system be used for assessing learning issues like vision screening, hearing, or deliver special education needs like speech therapy?
Great question. Yes, the answer is yes. We do have the ability, and I think, yeah, I had to go quick through the slide, so I did not have time to elaborate a little bit more, but I can address it now. Part of, you know, what we bring when I mentioned the physical devices, right, like a blood pressure cuff and all of that, we can also bring external apps to be used for health screening or for like a general vital sign screening. So we do have the ability to provide vision screening, hearing screening. There is a solution that we also use for speech therapy. Like it's a gamifying the therapy, so it's also more adopted for kids. So the nature of our platform, by being open, allows us for like bringing different solutions that might not even exist yet, but in 6 months they will be available, and we can, you know, like leverage that and, you know, bring it to our platform. But this is, yeah, absolutely something that we do.
Very nice. Any more questions? We got a minute or two. And while we're hanging out, I will just throw out a reminder to our attendees. During our lunch break after this session, we do have a networking opportunity available. So if you haven't yet signed up for the speed networking, please do. It'll be a great opportunity to connect with your fellow attendees, make some connections, introduce yourself. Also, if you participate, you may be entered to win a very cool prize. I believe we have an Amazon gift card available, so please join us, connect with your attendees, your colleagues in telehealth, and maybe win a prize. And I'm not seeing any more questions submitted. I know we have 2 minutes remaining, so thank you, Messias and Ram, for your time. Do you have any final notes for us you'd like to leave us with today?
The only final note, and this is just something, if you're curious about kind of where the limits of telehealth here, how far you can take telehealth and telemedicine. The most interesting places are outside of the US and outside of California. We have done a lot of work in Guyana, in the middle of the jungle, placing clinics in some of the most remote places on Earth. Literally, so multiple videos you can see on our website. We just got back from Guyana 2 weeks ago. And it's amazing how you go to a indigenous community in the middle of the Amazon. You train a community worker, so a local 18-year-old takes them a couple of hours on how to use the tablet and the devices. And they become kind of what we call the heart and hands. The doctor sits in the main city, be it in Oaxaca or Georgetown or wherever we deploy, and they do everything from ultrasound to stethoscope to EKG and all of this remotely and literally saving lives. So amazing stories. You can check those on our website and read about them. But you know, if we look at what we do in the US and in California, it's much more acute in places like that. And would love to chat with you about both use cases, schools to what it takes to do it in the middle of the jungle. Reach out to Messias or me and be glad to tell you more.
Great, thank you. I'm definitely interested in those super remote settings, so we'll be taking a look.
I'll put the link if you want on the chat of a recent video that I think you guys might find interesting.
Great, that sounds
about
awesome.
how it works over there.
Sweet, we'll get that posted in Whova as well, so all of our attendees can view that. Alrighty, I think with that, I want to thank you both for your time. A lot of great insights shared during this session, and I know for me at least, I'll be following up on the website to see some more, so I'm sure some attendees will do the same. Thank you both for being here to present with us today as a part of our Telehealth Summit, and we hope to see you in some future sessions. Thank you for that link.
Thank you for inviting us. Take care.
All right, thank you all. See you in our
Thank
next
you.
session.
Bye-bye.